Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
Hello, everyone. I'm Dr. Jeffrey Hayes, your host for this episode of ASRM Today. Today, I'm speaking with Dr. Matheus Roque. Dr. Roque has been working with reproductive medicine since 2010. He earned his master's in assisted reproduction in 2012 at the Universidad Autónoma de Barcelona in Spain. He earned his PhD in women's health in 2018 at the Universidade Federal de Minas Gerais in Brazil, currently working in Sao Paulo, Brazil at ASRM Reproductive Medicine. Dr. Roque has been on the front lines of the COVID-19 pandemic as cases continue worldwide. Dr. Roque, thank you for joining us today.
Hi, Jeff. Thank you very much for inviting me. It's really a pleasure.
In Sao Paulo and in Brazil, what are some changes that you began to notice as the pandemic began to spread?
Specifically here in Brazil, the first case that we had, the official case that was notified, it was in Sao Paulo, and it was in February 26. It was a male patient, a 61 years old male patient that he traveled to Italy. And then when he came back to Brazil, after some days, he was diagnosed with, he started with pneumonia. And after that, he was diagnosed with COVID-19. Then this was the first case that we had here. We were listening about the things that was happening. Okay, it started in China and it was described the pneumonia in December 31 that nobody knew the pathogen of that pneumonia. Then in January, beginning of January, it was discovered the pathogen, the novel coronavirus. But at this beginning, we didn't know exactly how would be the gravity and also how it's gonna spread around the world. Then it started some case in Europe, Italy, and all of these things. But in Brazil, we started this in February 26. The first case just started increasing, and the first case was mainly patients that came from other countries, mainly most of them came in from Europe, and most of them that have traveled to Italy. And I think that the first death that we had here, the first that was notified, official death related to COVID-19, it was in March 17. Then after that, the number of cases just started increasing. Probably here in Brazil, we have a sub-notification because we are not testing all of the patients. Then nowadays, we are on May 20. The number that we had from yesterday is that nowadays we have in Brazil 27,000 patients affected, confirmed case of COVID, and the number of deaths is almost 18,000.
So as you're getting to see patients, what is the approach you're going to take, or what approach have you been using to deal with COVID-19? Are you using things such as telehealth or alternative methods?
This was a great development that we had. I think that one of the positive things of this pandemic probably will be related to the telehealth. I think that all the areas, all the people are using videos, conference, all of these things, and I think that we will really change the way that we talk, we interact, so all of these things. Specifically in medicine, we are working with telehealth. The Ministry of Health in the beginning on March, I think that the first 10 days of March, they delivered something telling that we would be able or we would be allowed to work or to do telehealth. And then this really facilitates the way that we are working with our patients. Like I stayed for almost 54 days working only with telehealth with my patients. And nowadays we are restarting with face-to-face working with the patients, face-to-face, some presential patients, but most of them, they still want to keep with the telehealth.
Based on your experiences the last few months, what points would you like listeners to consider today as we move forward during this difficult time in reproductive care?
Probably what we learned with COVID-19, I think that's that the SARS-CoV-2, it showed us how vulnerable we remain. We were not able to detect this virus. We delayed to detect it. And when we identified and when we detected it, it has already spread around the world. And this is really amazing. Then I think that we need to strengthen our radar, our antenna concerning the global health to be able to ensure that when the next virus comes, it will come. We don't know exactly when, but it will emerge. That we can identify it as early as possible. And we need to catch it as fast as possible, and perhaps even snuff it out before we have this problem. We learned with this, like we are trying to do many research, around the world is focusing on research, but until now we didn't find any effective strategy to treat these patients. The most effective strategy trying to decrease the number of cases or trying to decrease the peak of the curve is to do social distancing, isolation, and quarantine. The same things that we used to do in the past. All the previous pandemics was exactly the same. We didn't treat, we were trying to avoid this. Then we need to, I hope that we can have a vaccine as soon as possible. And it seems that nowadays, with all the technology, the vaccine will be able to be developed faster than the last vaccines have been developed. And this is what we need.
I've been speaking today with Dr. Matheus Roque. Dr. Roque, thank you so much for taking time out to join us today.
Thank you, Jeff. It was a pleasure to talk to you. And I hope that I could help with some information concerning the COVID-19 here in Brazil and our experience with this.
This concludes this episode of ASRM Today. For show notes, other information, and discussions, go to asrmtoday.org.